Welcome to the American Indian and Alaska Native Behavioral Health webinar series, presented by the National American Indian and Alaska Native Addiction Technology Transfer Center. I'm Kate Trams, and I will be administering today's webinar. Today, Nancy Roget will be presenting Bridging the Gaps in Culture and Geography, Telehealth with American Indian Communities. This training series is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center, or ATTC. The National American Indian and Alaska Native ATTC is one of 4 national focus centers which serves the ATTC network. The ATTC network is a nationwide network made up of 10 regional centers, 4 national focus centers, and a network coordinating office. The map on this slide shows the locations of the 4 national focus center ATTCs. To learn more about our center, the network, or your regional center, please visit our website. Our next webinar in this series is scheduled for Wednesday, March 5, when Jackie Gray will present Disrespecting Our Elders, Elder Abuse Indicators and Screening in Indian Country. In addition to this webinar series, we offer another series titled the Essential Substance Abuse Skills Webinar Series, which provides an overview of competencies from CSAT's TAP 21 publication, Addiction Counseling Competencies. The next session for this series will be held on February 19, when Dee LeBeau-Hein will present Referral, Service Coordination, and Documentation. For more information on our webinar series, you can contact me at the email address or phone number provided on this slide. Our center is a NADAC certified educational provider, and we'd be happy to provide you with CEHs. The cost is $10 to do so. The CEH request form is available for download in the Files pod in the webinar screen. If you choose to download a file, a new tab will be opened in your browser, and you will have to click on the webinar window to return to view the webinar. If you are unable to download the documents from the webinar, please contact me using the information on the slide. Immediately following today's webinar, you will be redirected to our GIPR evaluation. We invite you to participate in this brief online customer survey. This survey asks about your satisfaction with the event and will take less than 10 minutes to complete. GIPR stands for the Government Performance and Results Act, and SAMHSA asks us to evaluate our events in order to comply with this act and provide improved performance assessment and accountability. SAMHSA uses information collected by these surveys to determine how many people have attended our events, your satisfaction with our events, and how useful our events are to you. We hope you will assist us in gathering information about our services by participating in our survey. Before we start today's session, I'd like to go over a few instructions for the Adobe Connect system. To view the presentation in full screen mode, click on the full screen button at the top right corner of the presentation pod. To return to the regular view, click the button again. You will be muted for the duration of this webinar. Please use the Q&A pod to share your questions and comments. Your questions will only be visible to me and the presenter, and I will pass your questions along at appropriate points in the presentation. There are options for providing feedback for the webinar by using the attendee menu, which is on the upper left of your webinar screen and is signified by a figure raising their hand. We suggest that in lieu of using the raising hand feature, participants should submit comments or questions using the Q&A pod, but please feel free to submit other feedback using these options. We would also like you to be aware that this webinar records participant attention time. If you minimize the webinar or are working in another window, the system will record your participation as inactive, which may be reflected in the number of CEHs received. The opinions expressed in this presentation are those of the presenter and do not necessarily reflect the official position of CSAT, SAMHSA, or the U.S. Department of Health and Human Services. Now I'd like to introduce our program director, Angelina Skinstad, as she will welcome today's presenter. And I ask that you give us just a moment as we are having one.
Thank you very much, Kate. And also thank you very much, Nancy, for agreeing to present for us today. When I think about what you have accomplished and how to introduce you, it is quite a challenge to be able to really captivate all your accomplishments. And first of all, I'd like to say that Nancy Roge is a very long time friend, has been an ATTC director since 98, and for 14 years we were both regional directors until the reorganization of the ATTC network. And now both of us have taken on responsibility of focusing on specific native or topics that are related to, for Nancy's case, telehealth and rural and frontier issues, and for us, American Indian issues. That will also mean that we try to collaborate and share resources as much as possible. And with Nancy's background in substance abuse treatment, especially treatment of adolescents, uh, she has a lot of experience in bridging gaps between communities, cultures, and geography. So thank you very much, Nancy, for agreeing to do this. And I look forward to your presentation.
Thank you, Anna Helena. I appreciate the kind introduction, and I want to say hello to everybody and welcome you to this webinar. I'm standing in for the original speaker, and so I'm very honored to be able to do that today and to work with this National Focus Area, ATTC. Let me get into the presentation, and I assume, Kate, this is being recorded and people can have access to the PowerPoint slides as well as to the recording later this week of the webinar. So let me go over the outline. A brief overview of the ATTCs, which Kate and Anna Helena did a nice job of. We're going to do a definition of rural and frontier data and definitions, rural alcohol and other drug use characteristics, American Indian and Alaska Native adolescent AOD use, use of technology, American Indian and Alaska Native use of technology, review of telehealth technologies, and then video conferencing with American Alaska Natives and American Indians. So let me move on. I'm not going to spend hardly any time. These are the 10 regional centers that Kate mentioned in her opening presentation. So there's 10 regional addiction technology transfer centers, and you can certainly go to the website to find your regional center. Here's what the front page looks like on at the website for the ATTCs, and you can find all the ATTCs there as well as the national focus areas. You've seen this slide previously that shows you where the 4 national focus areas are located and their area of emphasis. Here's their web address as well. So we are the National Frontier and Rural ATTC, and as such, we do a lot of different work regarding telehealth technologies and issues that folks who reside in rural and remote areas have to deal with on a day-to-day basis, and also for clients and family members and folks in recovery regarding how do you get access treatment and access recovery support if you live in more of these remote areas. So we're located at the University of Nevada, Reno, and it's not this snowy today, but it has been. We're appreciative of the snow as our part of the country has been in a drought. So let me go over really quickly our 4 main goals. We serve as the national subject expert and key resource to promote the awareness and implementation of telehealth technologies. We want to help create addiction treatment and telehealth competencies and develop policy recommendations, and also look at issues regarding license portability to help the workforce adopt the use of telehealth services, promote the use of state-of-the-art culturally relevant training and technical assistance activities to help the frontier and rural addiction treatment and recovery workforce, and help prepare students in addiction treatment and other allied health professions to use telehealth technology so that they are aware of these before they come into the field rather than waiting until they're already practicing. Just as a reminder, probably everybody knows this, but there are 566 at this time federally recognized tribes. You can see those are the different colors. The background is orange. You can see where the tribes are located. There's about 200 state-recognized tribes, and there's many unrecognized tribes that are seeking recognition at this moment. There's 12 Indian Health Services regions with about 220 IHS mental health treatment programs. And right now there are 38 urban Indian programs, all in metropolitan areas of the country, and about 70% of the people with behavioral health disorders are treated in urban Indian clinics rather than on the reservation. So let's look at some rural and frontier and data and definitions. Certainly when we look at many of the reservations are located in rural and remote areas. So let me go over some of this data. Over half the country's landmass is designated as frontier or rural. About 1/4 of the U.S. population, or 62 million people, live in frontier and rural areas, and approximately 16 to 20% of those individuals experience substance dependence, mental illness, or comorbid conditions. And certainly individuals residing in these remote areas have higher mortality rates, higher suicide rates, and more severe alcohol and drug problems. And as we know, and when we look at the literature, this is because usually they have to wait to receive treatment services, and so their conditions get worse. And certainly we know that with both mental health and substance abuse related disorders, the longer you wait, the more the problem does not go away, and the more severe the problem becomes. Studies show that those residing in rural areas use substance abuse treatment less often than those in urban areas, and that's because of barriers like geographical barriers, and as well as their stigma associated with receiving treatment, especially if you live in a small town or you live on the reservation. Everybody tends to know your business. Also, specifically, there are fewer substance abuse treatment programs in rural areas, and yet there's this great substantial need. There's also data that shows that rural probationers may have to travel long distance to receive their services. So those folks involved with the criminal justice system may have to wait even longer to get treatment services. Rural probationers are less likely to be involved in peer recovery support programs or self-help groups. There's some new research out in 2012. And then a number of researchers have cautioned against treating rural areas as all being the same, and have suggested that the differences in health outcomes among rural residents may be as strong as those differences between rural and urban residents. And so what we're saying here is that if you think, oh, all rural people or folks that live in rural and frontier areas have the same kind of problems, that's not true. So if you've seen one rural area or one frontier area or one reservation area and you look at their substance use disorder problems, you've seen one. There's not that many themes. Certainly when we look at the economic difficulties that have been going on in the last few years, we can see that these downward economic opportunities have contributed to an aging of rural America with significant out-migration of younger persons. In other words, that we see young people leaving the rural and remote areas to go into more urban areas to find work. And a lot of times what we have is we have younger adults, the younger adults that remain in these rural areas are less likely to be, or to, they're less educated, less likely to be working or earning a living wage. And so this stay-at-home group is probably higher risk for substance abuse. And this comes out of an article. You can see the citation there. So the similarity and prevalence of substance abuse and associated problems in very economically depressed rural areas to economically depressed inner cities has led to the phrase of America's rural ghetto. And so we seem to have that issue going on. For many years, the assumption was that if you lived in a rural community, that rural communities were more nurturing than urban areas and offered more protection against substance abuse. And actually, that's not the case. In the last decade, several major studies and reports have found that rather than being a safe haven, rural areas experience significant rates of substance abuse. Okay? And in a study of adolescents in mid-sized rural communities, Elliott and Larson found the barriers to receiving care included lack of healthcare information, lack of healthcare access, poor insurance coverage, parenting issues, and confidentiality concerns. Just to list a few. Then look at, just to remind folks, I'm sure everybody knows these definitions of rural. For this particular article, they did a nice job of defining rural. Rural adjacent, that means consists of non-metro counties with any mix of urban and rural populations adjacent to the metro area. Rural large consists of non-metro counties with an urban population of 20,000 or more, not adjacent to a metro area. And then rural, medium, and small consist of non-metro counties with urban populations of 2,500 to less than 20,000, not adjacent. And then you can see the very small had less populations of 2,500. And you can see this chart. I'm sorry it's a little small, but I didn't want to enlarge it to make it pixelated. But you can see many reservations in the United States are in frontier and rural areas, and so they have similar problems as we had discussed, and then probably problems are more exacerbated. So let's look at some data regarding rural youth. Okay, rural youth ages 12 to 17 in all three rural categories that we just talked about have higher rates of past year use of alcohol, cocaine, and methamphetamine and inhalants than urban youth. And methamphetamine and alcohol use are higher in rural areas than in urban areas. And the more rural the area, the higher the use. So the more remote. Rural youth are also more likely to have driven under the influence of alcohol or illicit drugs or alcohol only than youth in urban areas. And when you think about it, it really makes sense. There's one way to get around an urban area or in rural areas, and that's to drive. There's no public transportation, and so if you're out drinking and drugging, it only makes sense instead of being able to get on a train or a metro system or a bus that you unfortunately would probably drive. And so more rural the community, the more likely young persons are to have driven under the influence. And then given that rural locations are smaller and behavior is less anonymous, drug-using adolescents may be negatively branded in their community, and so they're going to have a harder time aligning with healthier peers. And this would be true certainly for reservations as well. For kids who get identified as having problems, sort of get tagged as, oh, they're the troubled ones. And so if they try to align with their healthier peers or they get into recovery, they might have a more difficult time getting the support that they need to stay clean and sober. Also for rural communities, maybe placing youth at greater risk for engaging in unhealthy behaviors because they don't provide adequate recreational opportunities like many urban areas are able to. Also, if you look at rural AOD use, this was an article about Appalachia, and they talked about rural social practice that occurs in the woods where a lot of drinking and drug use happens. The goal for the kids is to get in a physically isolated area. They're unsupervised, and lots of drug and alcohol use goes on, as well as other kinds of high-risk behaviors. Also, in rural areas, you have the home risk factors. Many of the homes are secluded from public eye. They're only monitored by family members. And then there's a lag time between the youth when they get home from school and the parents arrive home from work. And parents that work night shifts sometimes leave the home unmonitored. And so that all raises the risk factors for drug and alcohol use. Rural youth primarily encounter, how do they get offered drugs and alcohol? Well, usually it's connected to their social network. It's rarely with strangers. So rural youth don't have strangers going, hey, you want to try this particular drug? It's usually someone in their kinship network. This would be true in reservations as well. So it's somebody associated with the family network. According to this article, most common offerers of alcohol and drug use included cousins or relatives the same age or slightly older. We might find this being true also on reservations and true for American Indians and Native Alaskans. And so let's look at some of the data regarding specifically American Indian and Alaska Native youth. I have a typo there. So Native youth experience significant and persistent health disparities, especially compared to other adolescents. You can see this comes from the SAMHSA data, and it's a little bit small, but you can see past month illicit drug use among persons aged 12 to 17. American Indian and Alaska Natives lead the way as far as past month illicit drug use among teenagers. So we sort of set the stage of what's happening in rural and frontier areas regarding drug use and alcohol use, and we will focus more on adolescents. But let's talk about technology. So in the general population, 85% of American adults have cell phones, 53% have smartphones, 80% send and receive text messages. This comes from the Pew Report 2012. And over half have gathered health information on their phone, and almost 20% have a health app. And 80% of Americans use the internet. So what do we know about American Indians and Alaska Natives' use of technology? Well, there's a lot to consider because there isn't a lot of data out there. So this is one of the reports that I found. It's on the Native Public Media website. There's their web address, their URL address right there. I found this study that was conducted. And let me just go over some information about access to technology and use of technology. This is a quote from the executive summary of this report. And let me read it to you. It says, by virtually any measure, communities on tribal lands have historically had less access to telecommunication services than any other segment of the population. Okay? And tribal homelands have stood like barren deserts and pockets across the technology-rich lands of the U.S. Okay? And so what happens is they said, we're going to do this study, and we're going to figure out what is the technology and internet use in Indian country. You can download this particular report from the Native Public Media website, and we should have access to that after the presentation as well. So let me talk to you about this particular report and the study that they did. The report surveyed American Indians, Alaska Native adults in 28 states representing over 120 tribes, and they found that American Indians and Alaska Native adults use media technologies at rates higher than the national average. Okay? Might be surprising to some people, but it actually is true. Here's some of the findings. Okay? This was the first valid and credible data gathered from the ground up on technology use, access, and adoption in Native American lands. And Native Americans are using technology when it's available to interact, communicate, share culture, and gain the skills needed in the digital world. 88% of the respondents reported that their tribe had a website. Might be surprising to some folks and not surprising to others. A majority of the respondents said that their tribe's website was used for posting events, photos, videos, health and safety advisories, press releases, and job announcements. And tribal websites were rarely used for streaming tribal radio stations, podcasting, or blogging. So those were less, those activities were seen less often. And also survey participants indicated the top two sources where they get most of their news, both national and international issues, from the internet. 68% over television, over newspapers, over radio, and certainly over magazines. So the internet, excuse me, was the #1 source for getting their news. A vast majority of respondents use computers at work. You can see 96%, and at home, 91%, while schools and tribal community centers were utilized by roughly 1/3 of the respondents for computer access. 99% reported using the internet and to receive email at least occasionally. National average was 73. Okay? And then 4 out of every 5 survey respondents have been internet users for over half a decade, for over 5 years. What I want to talk to you about as well is that on the Native Public Media site, they also talked about radio stations. And they have a list on that website of states that have Native American radio stations. And I'm going to show you, this is a screenshot from 2 of the stations. This one is in Montana, and it's the first and only Native radio station in Montana, and it's been in existence since 1996. And the next one is out of Wisconsin. Excuse me, and you can go to the website and see if your state, or what the Native American radio stations are in your particular state, so you can have access. Now this is another study that was done. It's from the journal Primary Prevention, and it's the use of media technologies by Native American teens and young adults in Pacific Northwest. So it's just representing the Pacific Northwest tribes. And you can see the authors there, Stephanie Craig Rushing and David Steffens. They surveyed 405 American Indians and Alaska Native youth, 13 to 21 years old, living in tribes and urban communities in Pacific Northwest, and identified their patterns of health information seeking practices and their preferences related to the use of technology. This is the only study that talks about Native American teens and youth use of technology that I could find in a pretty extensive search. So in this study, they found that over 80% of Northwest Native youth reported having a cell phone, and like very typical teenagers, they reported using the cell phone to text rather than talk. And if you have teenagers or young adults in your home, you certainly know that you can probably communicate with them much faster and much better if you text them or learn to text them. Here's some data regarding their use of a wide variety of media and technologies. So 78% use cell phones, 75% internet, iPods and MP3 players, 75% computers, 75% almost digital cameras, video games, and less than 3% reported never using computers or the internet. And use of social media, very similar to other youth. Social networking sites, 87% use MySpace or Facebook. They reported watching videos on sites like YouTube and posting photos online, like with Instagram. This is from the Pew Research Center, and you can see here for teens in general and their use of social networking sites, Facebook, Twitter versus adults. Teens certainly are using more social networking sites than adults. But you can see the Native American youth really matches what's being used across the nation. You can see here as far as social media sites, Facebook, Twitter, Instagram, YouTube. You can see the popularity here. High rates, and basically what the study found is that there's high rates of online health information seeking that these youth did, and over 75% of them reported searching for online health information. So here's a quote from the article. So it'll be necessary to design new media that contain Native-specific design elements and social, emotional, physical, and spiritual dimensions that are foundational to American Indians and Alaska Natives' health and wellness model. Implementing these strategies could provide essential movement towards addressing the ongoing health disparities that now impact these youth. And so what we're talking about here is folks are able to use the technology, they have access to it, and so we're going to start to see this huge demand for the delivery of services using telehealth technologies. So let me do a quick review of the literature. This is really, really quick, but I want to talk with you about what's going on out there in order to deliver substance abuse and mental health services. Video conferencing is probably one of the ways that people are delivering substance abuse and mental health services. But when you look at the literature, I did a systematic analysis of various articles and research that was out there, and they found over 800 articles just on delivering mental health services using video conferencing. They found 3 articles delivering video conferencing or delivering addiction treatment services using video conferencing, and now there's 4. So the addiction treatment field's a little bit behind. Now the VA certainly is the master of using video conferencing services for their patients, and with really good outcomes. I'll let you look at those. Also, Indian Health Services, IHS, serves about 2 million American Indians and Alaska Natives per year, representing, like I said, 566 federally recognized tribes. And you can see that they have implemented mobile telemedicine services since the 1970s. They have programs up in Alaska. They have telenutrition program as well, but they're also starting to deliver mental health services using telehealth technologies and specifically video conferencing. Now when we look at computer-based interventions, there's a lot of research going on now about computer-based interventions. And to date, there's more than 100 different computer-assisted therapy programs that have been developed for a range of mental health and behavioral health disorders. And really what we're looking at here is clinician extenders. In other words, that these computer-based or web-based programs are being put into substance abuse treatment programs, and so they extend the reach of the clinician. And so the client can do work on relapse prevention or drug refusal skills on their own, or have it be used as part of their group time individually. And so we're starting to see more and more use of clinician of computer-based telehealth or computer-based technologies. This is a well-researched computer-based intervention. It's called Therapeutic Education Services. It's NIDA funded, and they just got done with a study, I believe up in Oregon, with a Native population, and they found that these web-based interventions were acceptable, that the clients said, hey, this is not too bad. They did think that there needed to be adaptations to the intervention so it could enhance its adoption or its use. For example, they were talking about drug refusal skills, and in the drug refusal skills, they said, look the person right in the eye and say, no, I don't need those drugs. Well, that doesn't fit very well in some cultures. Also, the web-based intervention can help address barriers and treatment access. This is a study done by Rickman and Campbell. It's under review, and it should be getting published soon. There's also tons of web-based screeners. These are web-based programs where either the general public goes on and says, gee, do you think I have a problem with alcohol? And then they go through a series of questions and they get feedback. There's also web-based screeners that are designed for specific treatment providers or populations. Very good outcomes, and a lot of it is based on the expert literature and looking at brief intervention. There's also web-based support groups, which we're starting to see with a variety of mental health conditions. We're starting to see a little bit with substance use disorders, but if you can imagine all sorts of different health conditions like cancer, diabetes, heart disease, tons of web-based support groups where people can get in and interact with folks who have similar conditions and get support and information. Here's an example of a recovery support group that's being sponsored by Centerstone. They're vrecovery.com. They design these various web-based support for different treatment providers, and you can see some of their work here. What we do need to know, what the research says is web or computer-based smoking cessation programs do not work well for adolescent smokers, whereas they have some really good outcomes for adults. There are also some literature regarding Second Life or virtual reality programs allowing people to create avatars and to provide treatment services in this kind of setting. There's also video games that researchers are using to help people with their drug-seeking behavior and as relapse prevention. There's always the telephone. There's some very good studies regarding recovery support using the telephone. Also, as part of the telephone, there's interactive voice response, which is a computerized phone where people can call in and record how bad their cravings have been, and then they can listen to a 1 or 2 minute sort of educational module that says, if your cravings are bad, this is what you need to do, and it's all done on the phone, so you don't need an expensive computer or anything like that. There's also mobile phones. There you can see some of the work with HS and those folks out of Wisconsin, getting some good data regarding how to use mobile phones to let you know. They have GPS systems in, and to let you know when maybe you're in a high-risk area where you used to use. The phone will go off and say, hey, dummy, what are you doing? You're in a high-risk area. So there's lots of interesting things going on. This is my favorite smartphone app. I certainly need to download one of those. It says, are you sure you need that muffin? Finally, there's also texting. There's a portable contingency management that shows some good outcome research, and people are able to earn vouchers for negative BAC tests, and they got text reminders about sending a video of them taking a breathalyzer test and those results. Also, the folks in the study got thank you texts. And then there's basic web portals, which people design HIPAA-compliant web portals that then treatment providers can offer video conferencing, email, and chat substance abuse treatment-related services. Now, can you form this therapeutic relationship using telehealth technologies? And actually, the research says you can. You might have to get a little bit better at some of the type of strategies you use, but there's certainly competencies out there. ATA has competencies developed for doing video conferencing, both in a healthcare setting as well in the home. There's some real interesting data. This is Jay Shore out of Spiro Manson's shop in Colorado, and he has done some studies with American Indian women with histories of PTSD and domestic violence, and many of those clients reported that actually they preferred video conferencing over seeing somebody face-to-face because they felt it was easier working with an unknown provider over the video because it provided distance and it facilitated a feeling of safety that they didn't necessarily feel when they had to go see somebody in person. So there's some interesting data there. I'm getting ready to sum up here for you. I want to let you know that there is the USDA is going to be having a RFA coming out to support mental health facilities in rural areas to purchase video conferencing equipment, so please look for that. There's the website for that, and I'd be happy to answer any questions you have. I know I went very quickly through the material, but I wanted to make sure I got through it all. I can certainly go back to different slides and answer any questions that you have.
Thank you so much. And I just wanted to let people know, if you didn't already see, there is the Q&A chat pod where you can submit your questions, and I will read them aloud as they come in, and we'll have Ms. Roget respond to them that way. And if you haven't noticed yet, we did have a comment already that was shared with the audience. And so you can read that there. Just some more information on some tribes that one of the attendees wanted to share. So we have a question from Lisa. She asks, can you go back to the USDA funding?
Sure. So if you, and yeah, it actually is a USDA, so it's, and they are supporting mental health facilities in rural areas, and they have $50 million available. I'm not sure if the grant is out yet. This came out mid-December, December 10th. And so go and check their website, but we know that this is the way several entities were able to get their equipment purchased in order to deliver mental health services using video conferencing primarily.
Great. We do have one quick sort of technical question from someone, so I'll just address that at this time since we don't have other questions, but yeah, we'd welcome anyone else to submit more questions about the presentation. Someone asked about how you download the files, and if you notice there is a pod of files on the lower left hand corner of the webinar screen. And if you select one of those, then you should be able to click that upload file button, and it'll actually open up a new tab in your browser. So you will have to click back to get back here once you're done with that, but that should work for downloading the CEH request form and the handout of today's slides.
Okay, let me make a couple other comments too. And I really ran out of time to talk about them, but I really think that some of the areas that we can look at that where we can make some inroads fairly inexpensively and maybe having a big impact was around these Native American radio stations. And I say that because there are, I forget what the website said, but there were numerous radio stations. They didn't cover all the states, but there were numerous of these tribal or Native American radio stations, and they already served a huge purpose for their communities. And one of the things that we're looking at right now is if you go into iTunes and you look at podcasts and you type in recovery support in the search function, you can see that there are tons of podcasts, so audio recordings of recovery support, talks, messages, radio shows, and we know there's and even if you go and Google recovery radio shows, you should be able to find a lot of different recovery radio shows. And I think if you already have, like these states that already have these radio stations that are run by American Indians and Alaska Natives, and they're already serving the community, this is a great way to start getting messages out about recovery support. And all you need to do is you could listen to it in your car over the radio station, you could listen to it on your phone, you can listen to it on your computer. Many of these stations would do what we have done as well, which is record talks and store them as podcasts so that people could go and download them to their iPod or to their MP3 player, or if they have internet access, they can simply go and listen to it. And you know, this would fit with urban natives as well, because when you think about it, you spend a lot of time in your car, whether you're living in remote areas, in frontier rural areas, or whether you're stuck on the freeway. And so we really think that this will probably be one way of getting some recovery support services out there. So I'm going to go backwards, and hopefully, you know, don't look at the screen, folks, while I go back, because I really want to talk about this website. And by the way, I don't own the website. I don't get any reimbursement from them. So there's no, I'm not trying to promote something that I have any kind of attachment to. I just think it's impressive that they have these radio stations. So here's an example of two of the radio stations. You can see here on the left-hand side, they have community calendar, public service announcements, song requests, birthday requests, staff links. They have welcoming. Let me see here. And here's the other one. They didn't have as many of those things listed. This is in Wisconsin. But when we look at this, let me go back to the main website here. And I should have done a screenshot. But this is the report. And here's some of the quotes that come from them. But this is really the website to check out, the Native Public Media. And you can see this, if you go up here to the radio link, you can click on that, and then it'll come up with a listing of the states that have the different websites. So can I answer any other questions? I see that there's a couple up there.
Yeah,
Kate, will you help me with this?
absolutely. We'll go to Rachel's question next. It says, I am a member of the Spokane tribe living in Portland and am a peer in recovery. I am in the process of building a distance curriculum for a dialectical behavioral therapy group skills training for peers. How would I go about finding out more about the teleconferencing systems you mentioned?
Well, one is you can go to our website for the National Frontier and Rural ATTC, and we have lots of different PowerPoint presentations up there. We have different curricula that's available for download. that you can look at, and it might provide you some direction. We have a brand new PowerPoint presentation that talks about HIPAA compliance video conferencing, and it provides a checklist so you can make sure that if you're actually doing treatment or counseling using some kind of video conferencing over the web, that you would make sure that you adhere to all the HIPAA compliance rules regarding privacy and security. So check that out. If you have questions as well, you can always email us. I think my email is up there. If not, you can go to the website and just our email should be there. So we should be able to get you should be able to get a hold of us. Kate, do you want to do the next question?
Absolutely. We have a question from Jane. Can you review reimbursement issues for the provision of telehealth in rural versus urban areas and how HRSA defines professional shortage areas for child and adolescent behavioral health services?
Wow, that is a long, that would be a very complex and long answer. Um, I think we have some resources for you. If you email us, we can email you a map that several of the HRSA-funded telehealth resource centers have put together regarding the definition that you're seeking between urban and metro, and the difference in reimbursement, and what it has to do with Medicaid and Medicare. Um, Basically, I can tell you a simplistic answer is that reimbursement is usually by state, and they have we have access, and we can certainly share it with you, a great website that shows the different policies that are laws that states have passed regarding reimbursement for telehealth. What I can tell you off the as well is that Medicaid and Medicare at this point are only reimbursing for video conferencing. They do not reimburse for any of the computer-based interventions, the mobile phones, the recovery support, uh, online support groups, or the web-based screeners. None of that is supported at this point, except for, I will say, some of the web-based screeners are supported in emergency rooms where they are using the web-based screeners or their interactive voice response as part of their expert screening. So screening, brief intervention, referral to treatment. But we certainly can help point you in the right direction and get those definitions, and then have you look for your particular state.
Great.
Okay.
All right, we have another question from Lisa. I'm curious about whether you know of any tribes that have utilized Motto and Bostrom's from 2001 letter writing campaign for suicide attempters using texts instead of letters. She says the Manilac Association in Northwest Alaska did this for a while.
You know, I'm not aware of anyone using that, and if I'm going to look up that article because that's very interesting to me. And the letter writing goes way back, as far as, you know, actually, if you look at historically, a lot of treatment had been conducted through letter writing, and even Freud has been reported. Even Freud did some of his treatment through letter writing. So certainly letter writing is an excellent way of doing some interventions, and some people are using email and all of that. We just don't see it in the literature much, and the texting literature is more about, that we're looking at, is about reminders rather than having a great substance to it.
Okay. Another question from Rachel. Do you have any data projections for telehealth services growth in the U.S. in general and or in Indian communities in the next 10 years?
You know, I've seen some projections not for native country, but I've seen it for the general population, and we really are looking in the next 10 years a huge explosion of telehealth, of people using telehealth technologies, and the use of technology, whether it's emailing your doctor, emailing your pharmacy to get your prescriptions refilled, being able to access your health record. I mean, some of those things are already going on. I think what we're gonna see things like mobile phones or smartphones that are providing, let's say, recovery support services may be approved as a medical device, and then they'll be able to be reimbursed. So while I don't have any specific projections that I can tell you today, I can certainly send those to you, but we really look at this we're just at the crest of the wave, and we're going to see a lot more services being offered and provided, and we're going to see a customer demand, actually, for folks going, no, it's easier for me to email my doctor and to get a response back in order to take care of my health care needs. I see there's one up there, Kate, about a Native American radio. I can't read the whole question, though, or comment.
Oh, yes. Eileen submitted that they have a Native American radio station in Maine, but she didn't have the name. So perhaps that's something that people could look up if they're interested in that.
Yes, Eileen, you can go to that Native Public Media website and see if your, excuse me, if the radio station in Maine is listed there. And if not, I'm sure these folks would want to know that and would want to list it as one of the radio stations available.
Great. All right, I think that looks like we had just had one more come in. It's a comment from Rachel. Facebook also has closed groups. I started a mental health support group, and that has now over 900 members. I also have a YouTube channel, podcast on YouTunes, and a blog on WordPress. There are so many innovations in the web communications.
Absolutely, and in fact, there was and now they've closed it down, but it was a YouTube-like a social media tool for events occurring on the res, and that was the abbreviation, so it was REZ. But it looks like that is no longer available. So thanks you guys for those that information about the Facebook closed groups and the WordPress and the blogs. Those are all really important social media activities available too.
Wonderful. It looks like that is the end of our questions. So, Nancy, did you have anything else any other comments you want to make before we finish up?
No, I just want to thank everybody for their time and for their great questions and for being patient with webinars. And I want to thank you, Kate, for your help, and Dr. Skinstead. And, you know, it's a nice collaboration between our two national focus area ATTCs. So thank you for this opportunity.
Yes, and we greatly appreciate you stepping in and presenting for us today. It was wonderful to have you with us. So I will just give some follow-up information. Please stay online as we close out the webinar so you can be redirected to our survey. Also, watch your email inbox for our follow-up, which will include a link to the recording of this webinar. If you check our website regularly, you can see we always update that with the links to the recordings, so you can not only see today's recording, but recordings of other past webinars in this series and our other series as well. We hope you'll be able to join us for the next webinar in this series on Wednesday, March 5, when Jackie Gray will present Disrespecting Our Elders, Elder Abuse Indicators and Screening in Indian Country. We also hope you'll be able to join us for our next webinar in our Essential Substance Abuse Skills webinar series on February 19, when Dee LeBeau-Hein will present Referral, Service Coordination, and Documentation. Thank you for your time participating in the session today. We hope you have enjoyed the presentation and